OMR series, and today I'm going to deal with labor and delivery. I'm Dr. Sowmya here to take you through one case which is very important for your OSCE exams. And here I have Dr. Tabinda, who has been a very great mentor with us. Thank you, Tabinda, for joining.
Thank you, Dr. Sowmya.
So this could become like an examiner and the students' feedback session. Thank you, dear. And Meera is here as a role player. Thank you, Meera, for joining.
Thank you, ma'am.
Fantastic. So just to start with, so we always start with the success quote. Remember, success is the sum of small efforts which you do day in and day out. I'm sure you're all running on the right track. This is our small effort to help you to run faster and quicker. So we are going to start with a case where first I'm going to show you the candidate instructions. We have few seconds. After that, we are going to kickstart our task. Okay. So this is the candidate instructions. Okay, Meera, let's start.
Sure.
Hello, I'm Dr. Sowmya here, one of the doctors in the clinic. Can I know your name and age, please?
Hi, doctor. I'm Hadina. I am 34 years old right now. Yeah.
Perfect. Is it okay to call you Hadina?
Yeah, sure. Please.
Okay. Hadina, what I understand is you are 38 weeks and the pregnancy is going really good so far. And this is your third pregnancy. And because you had a previous cesarean section, you are here to discuss further management. Am I right?
Sure. Yes.
Okay. As we are meeting for the first time, I need to ask you a couple of questions and then probably we can discuss about the further management. Will that be all right?
That's totally fine, doctor.
Okay. So could you please take me through your pregnancy so far, how it has been so far?
Yeah, the first one was a normal delivery. Then I had to go through a C-section for the second one because it was a breech presentation and, I had issues. Then now, yeah, I'm pregnant again. I have 38 weeks. So far, I don't have any issues. It's just a normal checkup.
Okay, perfect. Thank you. So this pregnancy has been fine. And the last one, which you underwent cesarean section. So how many, did you have any issues during operation or post-surgery? And how old is your kid?
The first one is 6 years old. The second one is 3. We don't have any problem. It's only, the baby, he didn't turn and that sort of issues. Apart from that, I don't have any surgery care.
Perfect. Thank you for letting me know that. So, and apart from that, are you generally fit and fine?
Yeah, I just want to mention that I have latex allergy.
Okay, thank you for
an issue with that. Yeah.
Okay. So once we will make sure that that is documented, and also you'll be wearing a red band around your hand so that everybody in your care will be aware of the same. Okay. As well, you are all taking the regular multivitamins. Other than that, are you on any medicines?
No other medicines, just regular vitamins.
Okay. Are you, have you undergone any other operation other than the cesarean section?
No, only the C-section.
Okay. And we need to ask you this general quick questions to all the women who visit us. So do you smoke?
No, I don't. I don't smoke.
Do you drink?
No.
Okay. Any drugs for fun?
No, nothing like that.
Okay. What's your height to weight ratio?
Well, I am 75 and I think 175 centimeters. It's normal. It's a normal ratio.
Okay. Fantastic. Thank you. And whom do you live with?
My kids, my husband, we live at, Progression.
Okay. Is everything fine? Are they supportive?
Yeah, they're very supportive. I have a very good family.
Okay. So do you have anybody in the family who is affected with high blood pressure, high blood sugars, anything like that?
No, they're all healthy. We don't have any.
Okay, fine. Okay, and coming back to this current pregnancy, at present, do you have any pain or bleeding, anything of that sort?
No, nothing. Everything is just normal. Everything is going good.
So do you feel the baby's movements well as well?
Yeah, I am. I'm able to get the movements.
Oh, okay. Hadina, I just want to quickly recap what we have spoken so far. This is your third pregnancy and you're into your 38 weeks. Previous all pregnancies were fine except for the cesarean, which you got it done 3 years back. You are allergic to latex. Other than that, everything seems to be fine, including the scans and the blood tests.
Yes.
Right?
Yes. I have some questions, doctor. Can I try for a vaginal delivery this time?
Yes, I'm coming to that only, Meera. So, sorry, Hidana. Basically the thing is, the woman with the previous cesarean section, they can deliver normally, especially who has got a normal delivery like you. Generally,
Okay.
3 out of 4 women can deliver normally, especially in your case because you had a normal delivery before. 9 out of 10 women can deliver normally. However,
Okay.
it's very, very important to make sure that you deliver in the hospital and you are monitored. The baby's heartbeat is monitored continuously because there is a possibility that less than 1 in 100 women, there is a possibility that the scar can give away, which if it happens, it could be risky to you and the baby. So, continuous monitoring will help us to pick up this at the earliest. Okay, so we can monitor you and take the decisions quickly. Am I clear so far?
Yeah. Okay. So, is there any chance for me to go for an early labor or,
So what we do is, so we would be discussing your case with the consultant and there would be a plan as well for you. So we would be actually, if you want to have a normal delivery, definitely we can see if you start on your own. If you start on your own, the labor pains, if you start on your own, the moment you come in, we'll admit and we'll see how it is going and the babies would be monitored. The baby would be monitored. If at all, if you are not going into labor on your own, there are 2 options. Some women in your place would want to start off the labor by using probably the catheters, or some would want to have a repeat cesarean section. So if you want to start off the labor, we would want to make sure that we will use the catheters which are latex free. Anytime you get admitted, we make sure that you wear a red band and all the equipments what we use will be latex free. Okay. And if at all, if you have to use the catheters to actually dilate the neck of the womb, that would be latex free. Okay. And the second thing, we can also use a rod, which is called dilapan, which could be inserted in your neck of womb, which actually works by absorbing the water and helping to dilate the neck of the womb. Okay. What it is during this time, we are going to continuously monitor you. Okay. And at that time, if you choose to have a repeat cesarean section, or you want to, because I want to give you all the options so that you can choose what is suitable for you. Okay. So if you want to choose the repeat cesarean section, of course, you need to understand that there will be a scar once again. And there is a probability that probably next time when you become pregnant, the afterbirth can get stuck and afterbirth can be placed low. So those are the problems which you can expect in the future pregnancy. Okay. So you can decide which is the one which you want. Whichever the case, you need to be definitely getting admitted in the hospital.
Okay. This I'll need to discuss with my husband. Meanwhile, I would like to ask you about the contraception after delivery.
Sure. The contraceptive choices depends upon whether you want to completely breastfeed the baby or not. Based on that, we can even give you pills based on what time you would be wanting to have. We can use the implants which is placed under your arm, or we can use the device, the hormone device, which we can give you. But we will not be advising you the condoms or the diaphragms because mostly they are made of latex. Okay, so that is something which you need to be thinking of. Of course, we can discuss with you the contraception and spacing of the pregnancies once you have delivered, but you have choices to make based on that current condition. We would be able to provide you what is best suitable for you.
Okay, that's clear. Yes.
Okay. Anything else in particular you want to ask me?
No, I think that's it.
Okay. And meanwhile, so I have given you the choices, what you want to have. Meanwhile, anytime if you feel there is a pain and there is a reduced baby movements, or you have bleeding or the water leaking, you have to come to the hospital immediately. Okay. And also we would be putting you in touch with anesthetist doctor. That's the doctor who gives you the pain relief medication so that you can have a word with him, because many times women who want to go in labor, they would want to choose the options for the pain relief as well.
Okay, yes.
And
Sure.
also, we would be providing you with the information leaflet so that you can go back and have a look. And if you wish, we can provide you the support groups where you can talk to the women who are on your page, who
Wow,
have
that's
gone.
great. Yeah, thank you. Thank you so
And
much.
not to forget the GP, because we need to include them in your care as well. So we could be able to make sure that you talk to them as well, like they are included in your care as well.
Yeah, sure. Thank you. I'll do that.
Fantastic. Thank you. Thank you so much, Hidana, for meeting me. Thank you.
Thank you, Doctor.
Thank you. Yes, Tabinda, I think we are ahead of 9 minutes.
Yes,
It is.
Dr. Sowmya.
Yes, please.
Yeah, timely done. That is very well done, Station. It was Dr. Sowmya. You have covered all the points. Actually, your introduction was well, and you built a good rapport with your patient, and you have used layman language all throughout the station. That is really good, and it is important. And you have taken detailed history. In that, you have inquired about the fetal well-being, any pains or any other symptoms that she is having, because she has had a previously surgery done for her breech. That is why it is important to know if she is having any pain or any symptoms. And you have also asked her about her wishes for delivery this time. And you have asked details of her previous deliveries as well. Even the medical surgical history, you have asked the allergy, the personal social habits, the family history. A few points which I think were important to mention was the cervical screening and the blood group and any reservations for transfusion. And also one important thing was the any symptoms for depression recently, that is the mental health. So other than that, the history was covered well. And you have explained her the risks related to VBAC versus elective repeat cesarean section. And you have discussed with her the labor planning, which was supposed to be in the consultant-led unit. And continuous electronic fetal monitoring, you have told her that it is important. And how to go about with induction, you have explained well. A special concern about her latex allergy, that was to be addressed, and you have done that also. And explain to her well that you are going to keep that in mind, and you're going to notify everyone using the red band as well. So postpartum counseling also, you have explained to her about the contraception and how to go about that. You have explained the different detailed options to her, and that is up to her how she is going to opt for that. And further advice also you have given to her about future. Also that how much birth spacing is important, that we will be telling the patients as well. So basically you have covered the whole of the station well. So it is a very good station. So hopefully this is going to be very helpful. Thank you.
Thank you, Tabina. Thank you. Yes, Meera, as a role player, what did you feel?
It was very clear and structured. I think all my queries was addressed during the discussion.
Thank you. Thank you so much.
Very empathetic too. Yeah.
Thank you so much. Yes, as Tabina rightly mentioned, the one thing which I always miss is about the depression part of it. Of course, reservations for the blood transfusion is very important because she is going for the surgery. Obviously, you should be asking how she's feeling recently. I always miss on this. So thank you, Tabinda, for notifying that. And Jehovah Witness, yes, that could be hidden agenda. So do not miss that. So just to take you guys through the summary of what it is. So introduction, history taking, you have to cover the present pregnancy, because if she's already in labor, latex allergy was an hidden agenda. So once they mention, it's a good idea to document then and there. It is easier. Mode of birth, you are supposed to be mentioning, even she mentions VBAC, explain about ERCS as well, so that you are covered. And the recent guidelines, it mentions 0.2 to 0.7. So that's why I specifically said less than 1 in 100. And of course, the 9 out of 10, the success rate you are supposed to be telling. And latex-free catheters are dial-up-on. Dial-up-on is something which is actually very good, but you are supposed to be giving them the options. What if she doesn't start the labor? Consultant opinion is a must in all of this. And continuous electronic fetal monitoring, one-to-one care, all that you are supposed to be covering, and the contraception part. So basically, it's a short case. You are supposed to be covering on time. And if you go on, well, you should be able to cover in 9 minutes, 30 seconds. Just to give you what the competent and the non-competent, obviously you are supposed to be covering for all of this. Many people forget to greet the patient and confirm the name and age, which you should never miss. It's a very important point, and how you build a rapport. VBAC versus ERCS, irrespective of what they want, you are supposed to be putting the options on the platter and let them choose. Labor planning and safety is very important. Inductions, if she doesn't start labor, if she goes in labor, what can happen? Scar rupture, you're supposed to be telling. Here, the discussion was not about hospital versus home birth. Still, I had to mention the scar rupture because she has to be aware. And this is not the final discussion. You know that you have 10 minutes, but need to cover all the points. And latex allergy, if you don't ask, they are not going to tell you. And that is where you will be ending up with the problems if you miss on the latex allergy. And contraception counseling, yes, because it's latex allergy, don't miss on commenting on condoms and the diaphragms. Pregnancy advice and the of course, I didn't tell her you can become pregnant next in 18 to 24 months because I thought this was too early for her to tell the next one. But you can always say that we will discuss that next when she wants to come. And yes, communication style is very important. Check the understanding, go about what you do. If you could observe, I said Meera in between and immediately I corrected because it happens. Probably the previous task you still remember and you are going to do that. So, but immediately correct it because it's very human to tell wrong things. But once you identify, correct those things. Guys, this is a simple task which you can easily score, and patient simulated task will only be one in short cases. So it's very, very important to do it well. And remember, difficult roads, destinations. So it's a small effort to make your life easier. Thank you, Tabinda. Thank you, Meera, for making this wonderful. Thank you so much, guys. Thank you.
Thank you. Thank you, Doctor.